مساكم الله بالخير جميعا. حياكم الله. Welcome to this occasion of Forensic Society, Saudi Society of Forensic Medicine. Today is my pleasure to present my colleague, Dr. Mohammed MADADIN. He is the consultant and associate professor, chairman of and chairman of Department of Pathology, Vice Dean, College of Medicine, and College of Medicine of Imam Abdurrahman bin Faisal University. He is also the chair of exam committee at the Saudi Scientific for Health Sciences. I'm very glad to present Dr. Mohammed MADADIN. Today his subject is very interesting for all the participants. It's called COMMOTIO CORDIS, and I would like if the participants would like to ask any questions through the Q&A. There is a side to ask the questions at the end of the presentation. Inshallah ta'ala, he has the chance to answer all your inquiry and your questions. Please, Dr. Mohammed, go ahead.
Okay, thank you very much, Dr. Ahmed. First of all, I would like to thank Saudi Society of Forensic Medicine, Dr. Ahmed Al-Yahya, the chair of the society, and all my colleagues to having me today and giving my opportunity to present this presentation. Today, inshallah, I'm going to talk about the COMMOTIO CORDIS. Basically, the COMMOTIO CORDIS term or terminology, I think you should know it if you are a forensic practitioner or you have heard about the COMMOTIO CORDIS. However, today we will go much deeper and see the literature about the COMMOTIO CORDIS and what reality and review and see more literature about the So before I want to show you this a few seconds. I hope the video is you can see it now. Have you seen this video? Is it showed appropriately?
Dr. Mohammed, the connection, you have a problem with the connection and the voice also, please.
Okay, I'm not sure if the video is showed or no, Dr. Ahmed.
No, the video is not clear, not go properly.
Okay, I will try to repeat the video, inshallah. Okay, thank you very much. It seems clear video and good sound as I see in the chat. So, what is the cause of death in this case? There's sport, the karate, and it's championship, and all of a sudden, it seems after very minor interaction between the two players, one of them fell down and did. So what is the cause of death in such cases? Is it easy to determine the cause of death? Or what are the challenges in such case where the COMMOTIO CORDIS, I'm not sure, in chat they tell me that there is connection problem. I think the others hear it very well. So I will continue. I'm assuming it's good connection, unless Dr. Ahmed inform me, please, if there is any problem with the connection. So in such cases, we have different challenges. We have the cause of death, because even if we assuming this death is a COMMOTIO CORDIS, we have to prove this or exclude other causes. So the cause of death in such cases is one of the difficulty or challenges of forensic pathologists. The manner of death is more challenging. However, in such cases where there is a witness or monitored by camera or CCTV or whatever, the manner of death can be easily concluded. However, the manner of death is usually much complicated in cases of COMMOTIO cordis. And the third challenging is how we convince the authorities that this minor blow caused the death, because it's be very difficult to convincing the legal authorities, non-medical ones, to that this minor injury to the chest is the real cause of death. So, what is the definition of COMMOTIO cordis? There are many different definitions and types and subtypes of COMMOTIO cordis. COMMOTIO cordis in general is called agitation of the heart, or another name is cardiac concussion. They're all the same, different names. So what is agitation of heart? The most detailed definitions is that the COMMOTIO cordis is mechanical stimulation of the heart by non-penetrating or impulse-like impact. So an impact which is not penetrating to precordium, which is the area of the heart from the outside, or the surface area of the heart in the chest. So this will lead to intrinsic cardiac mechanism that give rise different or disturbance in the cardiac rhythm. This rhythm will be different type, different duration, and different severity. And this can lead to death in absence of structural damage, which would explain any observed exit. So this is fully detailed definition. The COMMOTIO cordis is characterized by instant cardiac arrest, which usually it's always produced by non-penetrating chest blow. So there should be a blow that lead to cardiac arrest in absence of heart disease or underlying heart disease or any identifiable morphologic injury to the chest wall or heart. So this is the ultimate or the definition that accurate. However, it's not 100% accurate, because we will see that there are some cases that belong to some part of the definition, not all the part of this definition. I have to say that this is the contusion of the heart, which is called contusio cordis. This is a different issue from COMMOTIO cordis, and we shouldn't be confused between the two conditions. Contusio cordis is just cardiac contusion. COMMOTIO cordis is a different issue. COMMOTIO cordis is the complication of the impact that led to arrhythmia and cardiac arrest. Author concluded some inclusion criteria that should be available to categorize our death as a COMMOTIO cordis death. First of all, there should be a witness event of blunt, non-penetrating blow to the chest that followed immediately by a cardiovascular collapse. So we have to have chest to the blow, which is non-penetrating, and cardiovascular collapse. This all documentation should be well documented officially by the authorities. Then during the autopsy, we will not seeing any damage in the bone, especially the ribs and sternum, or the heart itself should be absent, and should be no medical history or no underlying cardiovascular abnormalities. If all this happened, this leads us to conclusion of COMMOTIO cordis, or let's say it's the typical COMMOTIO cordis, because as I said, it's not all, in the practice, it's not all the same. It's not easy as that. So we categorize or just categories in typical and non-typical COMMOTIO cordis. The typical COMMOTIO cordis should be chest blunt blow followed by cardiovascular collapse The cardiovascular collapse usually will occur immediately after the blow. It's in the literature, it's range from either immediately or seconds or minutes, the average 30 seconds, and it can be up to 3 minutes. Then the autopsy, there will be absence of any damage to the bone of the heart. This, if the definition or inclusion criteria is achieved, that's mean we have atypical COMMOTIO cordis. However, as I said, in practice is not always like that. So we have atypical COMMOTIO cordis if there is another findings. However, these findings are not enough to causing death. For example, if there is a blow to the chest, immediate collapse, and you find no major finding in the autopsy, you find just contusion in the lung or whatever. So still COMMOTIO cordis possibility is high, but however it's called atypical COMMOTIO cordis. Different subcategories of COMMOTIO cordis. Some authors categorize it to 3 or 4 categories. So the first category, which is the typical one, that typical COMMOTIO cordis with no evidence of injury or no underlying cardiovascular disease. Healthy man who get blow to the chest, collapsed and died, autopsy was negative, nothing in the autopsy. So this is the standard, the typical COMMOTIO cordis. Another group where there will be chest wall fracture in the ribs or sternum, and maybe contusions or even cardiac contusions in the chest wall or the heart. Or the third category, those who have the underlying cardiovascular disease. So they have the chest trauma or the impact, collapse. However, they have a history of cardiovascular disease. So, or they have, for example, positive alcohol, because alcohol is one of the risks that increase the risk of cardiac arrhythmia. So they have already the more risk than the regular people to have COMMOTIO cordis. The fourth category, which is any combination of these between B and C category, is called category D. So each death, we have to classify it. Is it category A or B, C or D, depend on the situation. The COMMOTIO cordis is considered as a rare disease or rare cause of death. It's occurred 2 to 4 deaths every year in the United States. However, it's believed to be underreported. So the one of the explanation why it's rare or why the number is few, because it's believed it's underreported, or much cause of death can be written other than the COMMOTIO cordis. And I think this is clear, because if I ask you how many of you have case or what case of death as COMMOTIO cordis, it will be almost maybe it's believed to be second most common cause of sudden death in athletes after cardiomyopathy. So if we have a death in athletes or during sport, usually our differential number 1 will be hypertrophic cardiomyopathy. We have to also put COMMOTIO cordis is one of the differential in such a death. The prognosis is poor prognosis. Even with the resuscitation, the mortality rate is over than 80%. However, this mortality rate decreased lately up to 50% after the people and sport facilities have the resuscitation measures and things. The number of mortality rate decreased from 80% to 50% because it needs immediate resuscitation in order to have good prognosis. So after we had the definition of COMMOTIO cordis, now we'll go to the pathophysiology of COMMOTIO cordis. Before going into details about the pathophysiology of how COMMOTIO cordis is occur, we have just mentioned some normal physiology of the heart. The normal heart activity is called sinus rhythm, which is when the heart contract and relax. and it's originate from the SA nodes, the sinoatrial node. At rest, the cardiac cells are polarized. That means there's a negative charge inside the cell and positive charge outside the cell. There are three channels, or we call it ion channels, allow the ions go in and go out to control the charge of the heart and contraction. These are the fast sodium channel, the sodium calcium or the slow channel, and we have potassium channels. In each cardiac cycle, the cell of SA node will start, it will first to depolarize. This leads to depolarization all over the heart. The depolarization, that means opening of the fast sodium channel, which allow the positive current to enter the cardiac cell, leading to contraction of the heart muscles. After that, the slow sodium calcium channel will be opened and will remain open for longer time, allowing cardiac muscle to maintain contraction, or it's called action potential plateau. So this is the first depolarization stage, where the fast sodium channel is open. Then the plateau stage, where the slow sodium calcium channel open, lead more time for contraction. Then the third stage, which is repolarization, where the potassium channel open, allow the potassium going out of the cell and to down the gradient. So the contraction of heart takes place in following sequences. First of all, the contraction of atria, then the contraction of ventricles, and relaxation of atria will be at the same time, then the relaxation of ventricles. The average cardiac cycle take around less than 1 second, it's 0.83 seconds. The electrical activity of the cardiac cycle is displayed typically on the ECG as the classic P wave, B, Q, R, S, and T waves. B wave represents the atrial depolarization. The QRS wave, it's come together as a complex wave, is represent ventricular depolarization, and the T wave represent the ventricular repolarization. The T wave is it take around span 0.15 seconds. It's very important because the relaxation of ventricles or the diastole begin right after the T wave end. T wave is very important here because it's associated always with the commoted cordis or the arrhythmia that causing the main arrhythmia type of commoted cordis is usually because the alteration of the electrical or the heart, it will be at the beginning or just before start the T wave cycle. So the main pathophysiology of that causing commoted cordis is mechanical, electrical arrhythmogenic failure, or that we call it ventricular fibrillation, the specific type of arrhythmia. Because the initial event, as we said, impact in precordial area with low energy effect. This will usually come in the most vulnerable period just before the T wave. This will lead corresponding to the ventricular repolarization cycle, which will trigger the VF or ventricular fibrillation. So following this period of cardiac cycle will lead to rise in left ventricular pressure. Also, this increase the ventricular pressure will likely activate the ion channels, leading to premature ventricular depolarization and VF or ventricular fibrillation. So this is the pathophysiology. The pathophysiology, by the way, of commoted cordis is well studied, and it's because, as I said, it's very common in sport activities where the collapse occur immediately in presence of the medical or paramedics personnel, ECG available. So this type of rhythm is well studied and documented. So what are the risks of contributing factors to death from just simple blow to the chest? we have different risk factors or contributing factors, or finding that show us that some groups are more vulnerable than other groups. First of all, the communicable cordis typically occur in young. The young people is the most vulnerable for communicable cordis. The average age is 15-year-old. However, in the literature, the range of cases documented between 6 weeks up to 50 years. Most of the cases are just between 12 and 20-year-old. So the young is the most vulnerable age group. Male, most of the cases is male. It's not known whether, because the male is usually more participate in the sport activity, or the, let's say, more violent sport activities. This is believed to have sport activities. Thinner people, it's fine. They have more risk because the impact will affect more the heart if it's hit the precordium area. So the thinner, where the fat usually people, they have subcutaneous fat to protect, to transfer the mechanical effect of the impact to the heart. So we have also four important factors within the impact itself contribute very major factors. First of all, the site of impact should be in precordial. So any hit in the right side of the chest, usually it will not lead to commotivo cordis. Should be in the left side of the chest, in the precordial area, which is around from the sternum to mid-axillary region, and up from second intercostal space to the sixth intercostal space. So this is the precordial area. It should be there. The head should be there. Second thing, the type of impact, smaller has more risk, because this smaller area will focus the or transmit the more energy, or transmit more energy to the smaller surface area. And if it's harder, of course, more force will transmit to the heart. The speed of impact, or the force or speed of impact, it's reported that the minimum 40 mph or mile per hour impact will lead to commotivo cordis. And also the timing of ventricular cycle. They believe, or it's believed, that early T wave, or just before starting T wave, it will lead to because, as I said in the previously about the mechanism, it will have more vulnerable to develop the ventricular fibrillation. So these four factors is important related to the impact itself. Also, the increased heart rate. Increased heart rate is having more risk because it shortens the heart cycle. So the heart cycle will be shorter than the normal individual. In such cases, that's why this also explains us why the sportmen or athletes during sport, they are more vulnerable to have commotivo cordis than regular people during regular activity. Other risk factor like alcohol. Alcohol usually sensitize the heart effect to catecholamines. So the alcohol itself increases the risk of arrhythmia. Also, the cocaine increase the risk of arrhythmia. So these believed to be risk factors. While the other arrhythmogenic drugs shouldn't be considered a risk factor because they are causing of arrhythmia. So we have to exclude arrhythmogenic drugs in order to diagnose commotivo cordis. We cannot diagnose commotivo cordis if there is positive arrhythmogenic drugs, because the arrhythmogenic drugs, they are by themselves can causing arrhythmia without anything else. So we never consider the arrhythmogenic drugs as cofactors or risk factor for commotivo cordis. No, because they are factors to arrhythmia and causing death. So this is, in summary, the most risk factors or contributing factor to death by committed cause. We said from the risk factors or contributing factor to the mechanism, the impact, if it's hard object, smaller diameter, high velocity, direct impacting the heart, in thinner people, over the heart directly or precordium, will at the time of T wave or the ventricular depolarization, this will lead to increase the activation of potassium channel, lead to cell membrane stretch, the ion change in the channel that lead to the amplified decimation of repolarization, which lead to ventricular fibrillation of the heart. So this is a very nice diagram, summarize or shortening the mechanism or pathophysiology of committed cordis. So there are different, the ventricular fibrillation is not the only arrhythmia that recorded during the committed cordis. There are different types of dysarrhythmia because of committed cordis are documented or can happen, like ventricular tachycardia, bradyarrhythmias, and aortoventricular rhythm. So different type, but the most common or fatal one is the VF or ventricular fibrillation. This is the areas of precordium. The surface anatomy is very important because usually we will in autopsy we will look for a site of impact or the primary impact in the chest. So what is the typical scenario or circumstances that occur in committed cordis? Different cases reported in the literature about committed cordis causes. The most common is sport activities, especially the activities that have a ball, like baseball, hockey, they have hard or iron ball. These sports have the highest risk, and that's why the athlete is most affected people by committed cordis. So most of the cases reported are from sport activities. Different cases reported is related to direct blow to the chest, like an assault, even if it's just a small assault or just punch to the by fist to the chest can lead to collapse and develop committed cordis. Some reported cases documented that CC occurred due to fall, especially on some protruded object or a blunt object that was directly or first hit the chest. Physical abuse cases, especially most of the cases that reported is intimate partner violence, and most of them is female, or all of them actually, all cases that recorded that the physical abuse due to punch in the punch in the chest were female. So physical abuse cases, we have to consider this. There's also cause child abuse reported cases that hit or blow to the chest cause committed cordis. Other accident from bicycle, motor scooters, and other car accident, motor vehicle accident reported cases of committed cordis. Different objects reported that hit the chest and caused committed cordis. The most common is ball or the hard ball, like baseball ball. The ball is used in the baseball. It's very common, the commonest actually. Other object like a vest, by hand, knee, stick, or other different blunt and specified blunt object. So always non-penetrating any blunt object can cause committed cordis. What the differential diagnosis? Usually, first we will raise suspicion when we have the circumstances during sport, or we witnessed a blow to the chest, or some even minor altercation between two individuals. immediate collapse, we will suspect commoted cordis. However, this is not enough to diagnose the commoted cordis. We will develop our differential diagnosis of sudden cardiac death because it's usually sudden death, most of the, or seems like a sudden cardiac death. So our differential could be any congenital heart disease, cardiomyopathy, myocarditis, the pathology of coronary arteries, other arrhythmia like long or short QT interval, Brugada syndrome, or as I said, toxic effect or cardioactive drug or cardiac dysarrhythmic medication. So all of this, our differential diagnosis. How we reach to our diagnosis in the death investigation. First of all, the circumstances. Circumstances is very important in diagnosis of commoted cordis, and actually it's the most important feature because, as I said, it was easy to diagnose it if it's witnessed, if it's recorded. However, it is very difficult to diagnose if there is no evidence or just the body found and no witness. It will be very difficult to diagnose the commoted cordis. So in the history, we have to have the chest blow, history of chest blow, which is witnessed, and the collapse of the will be related to the chest blow immediately after the chest blow, with usually no medical history or the disease has no significant underlying condition. And such cases, or crime scene, or suspect any case of sudden cardiac death, we have always exclude our common causes of death without any visible finding in the scene, like drowning, electrocutions should be excluded because these usually leave no signs. These usually lead to VF, ventricular fibrillation, and it's difficult to differentiate or identify that the trauma or the injuries. So in circumstances, it's very important to have some information about the case. Otherwise, it will be difficult to diagnose commoted cordis. Autopsy is very essential. Many guidelines standards, they say there will be no diagnosis of commoted cordis without an autopsy. Why? Because the autopsy is accurate cause of death. So it's very important. And of course, it's exclude other causes. And this is what we need, because all of other causes can occur in the same circumstances of commoted cordis, even if there is chest blow, immediate collapse, and could be due to congenital heart disease or coronary artery disease, right? So we have to exclude the others. We have to exclude, before we diagnose commoted cordis, we have to exclude the others causes to conclude the cause of death by commoted cordis. That's why without autopsy, we cannot diagnose commoted cordis. We will go through a routine procedure of the autopsy, general appearance, the age, as I said, usually young, doing the other routines. It's very important when we look for the external injury, what we call it significant, insignificant. That's mean usually you will find only abrasions or contusions in the precordium area where the site of impact there. Usually in routine examination, these injuries will be insignificant. If you see it, you will ignore it. Just discoloration or very minor bruise or just abrasions, usually you will just say it's insignificant. It's not enough to cause a death. However, in cases of commoted cordis, this is significant and could be, this is play a vital role in diagnosis of commoted cordis, especially if there is some history or circumstances. This finding will confirm the circumstances. It's very important to not to confuse with resuscitation injuries. Most of the commoted cordis victims during sports, they will have some resuscitation measures. CPR could be conducted. It might lead to fracture in the sternum, in the bone, the ribs, hemorrhage. So you have to have a clear idea about the history, what the intervention done for the victim, and to exclude any resuscitation injuries or related injuries. So this is an example of minor finding in case of commoted cordis. just red discoloration or just ecchymosis in this area. He didn't die. He was saved. This victim. This is the only finding was found externally at the area of pericardium, the discoloration. So you have to consider give always importance of any discoloration or any injury, even it's minor, in the area of the heart or pericardium area. You have to check the ribs sternum, making sure there's nothing, no hemorrhage in the pericardium sac or the pleural activity, pleural cavity. You have to examine the heart fully, because the heart will be diagnosis of commoted cordis will based on the exclude other condition in the heart. So you have to exclude congenital heart disease. You have to have the weight of the heart. You examine the myocardium, exclude any disease, coronary disease, and exclude any injuries, because otherwise it will be might be the injuries that required more force that caused death. Usually, up to a quarter of cases, petechiae and the pericardium can be seen, cases of commoted cordis, and it's reported that about 13% of cases there will be intercostal muscle bleeding, and some contusion in the lungs can be also seen as a sign of blood force back to the chest. And in other cases, usually we will not find anything else. Histology is very important to have section from SA node and AV node to exclude pathology. Any pathology in the SA node and AV node can cause arrhythmia and death. So we have to exclude that. As I said, without exclude all other cases, we cannot conclude the commoted cordis as a cause of death. So we have to take section from SA and AV nodes. Actually, there is no diagnostic histological examination for on commoted cordis. It's just at experimental level, and it's not. We will not follow this to diagnose commoted cordis based on the histology. So never diagnose commoted cordis. There is no specific finding of commoted cordis in the histology. Toxicology and biochemistry is very important. We might detect some risk factor like alcohol, which increase risk of arrhythmia. We have to exclude other causes of ventricular fibrillation, like electrolyte imbalance, like cardiotoxic drugs, as we said, should be excluded before diagnose the commoted cordis. Molecular investigations, very important to exclude arrhythmic disease like Brugada syndrome or other cardiac arrhythmia disease before conclude the cause of death by commoted cordis. So as you see, the commoted cordis diagnosed by exclusion based on the history or circumstances, exclude other possible causes or other differential to reach final conclusion of commoted cordis. So the last thing I would talk about is the medico-legal considerations of commoted cordis. As you saw during this presentation, the diagnosis of commoted cordis is not easy. It's carries some challenges, and the most important challenges is the manner of death. The manner of death usually, if commoted cordis occur during sport-related, unless otherwise proved. What's mean by otherwise proved? If there is intention to cause harm. In all of cases, the intention causing the harm from non-intention to causing the harm, this is what usually give us the manner of death in commoted cordis, whether it's accident or manslaughter. So depend on the intention. Usually during the sport activity, it will be considered as accidental unless there is intention causing harm. It's might to turn to manslaughter or قتل غير العمد. So homicide, the other end or the extreme end of commoted cordis is homicidal commoted cordis. It's very rare homicide unless there is intention to kill and the damage or the impact will be hard enough, and this is very rare occur in the committed cordis. That's why most of the committed cordis causes either accidental or manslaughter. So there is, from published literature, the researcher figured out that usually in poor socioeconomic backgrounds, poverty and poor education, and these people are more have risk to cause community cordis by violence, related to the violence. And this is because I think these groups, they have more prevalence of violence than the other groups. As I said before, the sport is the main arena where the community cordis occur. Because of no explanation, they found that black people, they have less course. Consideration is, first of all, to diagnose community cordis is challenging. The manner of death depends on the intention, which is sometimes difficult to determine the intention of the assailant. The recommendation, or what we conclude from this, or what we recommend from this talk today, community cordis registry. Some countries like United States, they have already community cordis registry. That registry, that any case of community cordis should be registered at that registry, so they can count or make public health statistics about all causes of community cordis, doing more research, identify the risk cases, risk factor, everything. So it's very important to have a registry or notification specific registry that just concern to the community cordis cases. Because it's believed it's underreported. That's why many countries, they still not developing a specific community cordis registry. Second message, I would deliver it to the forensic pathologist. Always don't ignore minor injury in the chest and the sudden death cases. If you have sudden death cases, any minor finding could have significant message for you. It's very important to have an awareness of avoiding injuries, especially in young people and kids. As I said, the most victim of community cordis are young and kids. Many recommendations about coaching techniques, using different balls in the kids where they're playing some sports or ball-related sports should be followed. Also, using chest protector. There are specific chest protector in the clothes, or that wear under the clothes, that have more protection, absorption, and impact to the chest, in order to avoid or minimize the cases of community cordis. At the end, I would like to thank you very much for your time and your listening. This is references I have used in my today presentation. They are almost all references about the community cordis. Thank you very much. This is my email. I welcome you to contact me for any concern, and I'm waiting for your questions. And thank you very much again. Thank you.
Jazakallah khair, Dr. Muhammad. Thank you for this nice presentation. Wallah, it's very heavy presentation, and the subject is really very interesting subject. I know the time is a little bit late, but there is, mashallah, there is still time for the lecture, and we have some questions, Dr. Muhammad. One question is, maybe it's related to the forensic. One question is telling we know that it is a cardiac arrest. Why we have still go for autopsy? This is one of the questions. Please, Dr. Muhammad.
Okay, autopsy reason usually is to find the cause of death. So we cannot, even if it seems to be cardiac arrest cause of death. This is the first of all. This is the general principle. Especially if there is committed cordis, usually it's sudden cardiac death related to some kind of trauma. So there's see the extension of this impact to determine the force that used to answer many legal questions. Autopsy should be done. So basically, autopsy should be done in every cases. I know it's not the rule in all countries or every. Sometimes in different society will be difficult to make an autopsy cause of death to have good. A right number of public health data, statistics about disease, about cause of death, about prevalence of disease. We have to do an autopsies. Thank you.
طيب, there is another question, Dr. Mohammed. One of the is from medical legal point of view, how you are going in the court. You are going to justify your findings, and you will tell the cause of death is a COMMOTIO CORDIS. You will write in the death certificate سبب الوفاة ارتجاج القلب أو COMMOTIO CORDIS. How you are going to fight for this result in front of the court? You know, it's very difficult to justify your finding. Tell us. This is one of the questions, please. Dr. Mohammed?
بعد اذنك يا دكتور ابو نواف او دكتور احمد، اتوقع يمكن عندي في مشكله في الاتصال عند الدكتور
يس قطع الصوت.
ممكن نقفل يعني.
طيب, by the end of this lecture, we would like to thank Dr. Mohammed Madadain for his great presentation. And unfortunately, we have still some questions, but inshallah, we will answer by the email. The answers for these questions will come to the people who are asking about these questions, inshallah ta'ala. جزاكم الله خير, and have a good night. شكرا جزيلا for everybody.
دكتور احمد معلش انقطع عندي المفصل الاتصال.
اي دكتور محمد, جست انه انقطع فاختفى صوتك تماما.
ايوه معذره.
طيب, احنا قفلنا, بس if you have كيف to justify your answer في الكورت اذا كان ممكن.
طبعا اهم شيء اعتقد انا قلت الموضوع هذا في البدايه انه it's very challenging to convince the authority that minor injury can cause death. The most important thing I think is to exclude other causes of death. It's very important. If you exclude everything and you rely on the circumstances and exclude all other possible causes, it's easy because COMMOTIO CORDIS is now well documented in the literature. It's there in the textbooks. It's well-known phenomena. It's well-known phenomena now. So I think it's easy for you if you did the case completely, exclude everything, making sure nobody will argue on other causes or possible other causes. You cover everything. I think at that time you can easily try to convince them that this is there, it's documented, it's already well-known in the literature. There's specific registry around the world to register these cases of death, and you can prove, inshallah.
طيب, there is couple questions. The one is if there is no specific finding externally, by the external examination you didn't find anything, and by the internal examination to the heart you didn't find anything, you will depend in the history for the diagnosis for the COMMOTIO CORDIS. Only history?
History and exclusion. History and exclude other possible causes. If you have history, blow to the chest, immediate collapse, with no other conditions, and autopsy, you exclude other differential diagnosis, other toxicology, other causes can cause sudden death, you are okay to diagnose.
طيب, one question, والله it's very intelligent question. It is related to our religion, Islamic religion. يعني I try to correlate between the Quran and our knowledge. This question is telling us this ayah, بسم الله الرحمن الرحيم, فوكزه موسى فقضى عليه قال هذا من عمل الشيطان إنه عدو مضل مبين. Is this the diagnosis of COMMOTIO CORDIS or not? This is one of the questions.
والله this is very nice. أنا أول مرة صراحة تجي على بالي. It's very يعني good correlation. ما أقدر أفتي فيها لكن it's very good correlation. I have to go and read about it صراحة.
ما شاء الله. عموما دكتور محمد, thanks a lot. جزاك الله خير for this
جزيلا لكم. ونشوفكم إن شاء الله تعالى في هذا الأكتيفيتي. شكرا لكم.
الله يعطيكم العافية. إن شاء الله see you soon in another activity. Have a good day and good night إن شاء الله. جزاكم الله خير. Thanks a lot. السلام عليكم.